Hi, everyone, and thank you for joining us today. My name is Jibran, and I serve as an editorial member here at Journal of Immunotherapy and Precision Oncology, or JIPO. It's an honor to have the opportunity to introduce Dr. Sapna Patel today. Dr. Patel, would you like to introduce yourself to the audience?
Yeah, Jibran, thanks for this opportunity so much. My name is Sapna Patel. I am the Dr. William Robinson Endowed Chair in Cancer Research at the University of Colorado, Professor of Medicine and Ophthalmology. In that role, I'm leading the Cutaneous Oncology and Cell Therapy for Solid Tumors initiatives.
Thank you very much. And of course, Dr. Patel brings an extensive expertise in melanoma and new investigational agents, including immunotherapy, to our discussion. So Dr. Patel and her co-authors recently contributed an article to JIPO, which was titled Selinexor or KBT330 in combination with immune checkpoint inhibitor in uveal melanoma, a phase 1b trial. So Dr. Patel, let me begin by asking you about the rationale for combining these agents.
Yeah, so Selinexor, most people will be familiar with it and its role in has an approval in myeloma and heme malignancy. It's a nuclear exportin inhibitor. So basically a protein inhibitor for nuclear export. And the short of it is there are lots of tumor suppressors that need to be in the nucleus of tumor cells in order to work, in order for those tumor suppressors to work. And so selinexor exportin inhibitors are basically stopping those from getting moved out to the cytoplasm. When a tumor cell moves those out to the cytoplasm, they are no longer susceptible to suppression of their tumor, and so then this can essentially be a driver mechanism. So in uveal melanoma, which is melanoma of the eye, fairly rare cancer, 6 per million in the Western and developed world. This cancer has some efficacy to checkpoint inhibitor, but it's not terribly high. And so the idea is in cutaneous oncology, certainly we need more effective therapies, but in uveal melanoma, where the checkpoint inhibitors are not working as well, is it possible there's also some nuclear proteins that are getting exported out to the cytoplasm? In this regard, some tumor suppressor proteins. And so we decided to look at it in combination with selinexor and standard of care checkpoint blockade.
Thank you for that explanation. And then can you briefly discuss the key safety findings and anti-tumor activity of this combination?
Yeah, so this was really exciting for us to have the opportunity to put uveal melanoma patients on this. It was considered phase 1b really because it was an exploration in singular cancer types, skin melanoma and uveal. There were some mucosal melanomas on the skin cohort as well. We ended up putting 10 patients on the study. They received selinexor in combination with checkpoint inhibitor. And the study had a couple of different cohorts. The one main cohort that enrolled here was in combination with single agent pembrolizumab. So 9 of the 10 selinexor plus pembro. And then one patient went on selinexor plus nivo in combination with ipi. So another regimen that's often used in melanoma. That one patient ended up having pretty significant toxicity. It was a dose-limiting toxicity of transaminitis. It was thought to be due to the nivolumab, ipilimumab checkpoint inhibition, as well as underlying disease, not at all thought to be related to the selinexor. And at this point, we had had 9 patients on selinexor plus pembrolizumab, and the responses were actually really interesting. As somebody who treats this disease for a long time, I've known that we don't see often objective response rates. So that was probably no different here. No official partial or complete responders in those 9 patients. But 8 of those patients had stable disease. So 88% of patients did not have progression as their best event. And in this disease, that is a real signal. More importantly, perhaps, is the progression-free survival. In almost all uveal melanoma clinical trials, including the FDA-approved tebentafusp, progression-free survival is about 3 months. So it's the first time point that you go to scan these patients. And in this study, the median progression-free survival was 6 months. So that tells you we are doing something to prolong the stable disease period, that translates into clinical benefit. So that does mean there is some signal here that this inhibition of nuclear export proteins is doing something additive to the pembrolizumab. Importantly, pembrolizumab probably has only about a 1 to 3% objective response rate in uveal melanoma, and it has that PFS of 3 months or so. So to see that in these 8 of 9 patients, we got that double, that was pretty helpful for us. What we saw as far as toxicity, it was a lesson learning for the selinexor. So selinexor is dosed at 60 milligrams twice a week, and that's a pretty tough dose to take. At that dose, we were seeing a lot of hematologic cytopenias. So basically neutropenia, leukopenia, thrombocytopenia, and anemia. And non-hematologic toxicities that we were seeing are things like nausea, vomiting, hyponatremia. But all in all, very few discontinuations due to treatment. Only 1 of the 10, and it was the patient on the ipilimumab-nivolumab combination, discontinued due to the treatment. And that's another marker of how well these drugs can be tolerated, is what is the treatment discontinuation rate was quite low in this study.
Thank you very much. And so where do you think is the future for this combination?
I mean, I think this is a real signal, and it would be nice to see this go forward in a phase 2. I think we got a little gun shy with the nivolumab ipilimumab combination with that one patient. So I think there might be another way to look at it and combine it with that checkpoint combination, in uveal melanoma. But certainly with single agent PD-1 alone, this combination does have a signal, and it would be good to see that in a larger follow-up study.
Thank you very much, Dr. Patel, for your time and commitment to research. So I would encourage everyone to explore the published article online and at the JIPO website. Once again, thank you very much.